welcome everybody to the Mindfulness and Life After a Lung Cancer Diagnosis seminar. And I really want to wish everybody well and welcome them to the program. And as I was saying, you can really make a difference in your health and your wellness and your energy levels. And, you know, there's a set of knowledge and a set of skills that you can develop. And this is the place. So I really want you to take in this kind of key skill around mindfulness and practicing a meditation technique. So this is very important for everybody. It's a key skill in my mind. So what are we going to talk about today? I'm going to give you the overview. So like what's within the context of maximizing your chances and et cetera, where does mindfulness fit into this kind of complete lung cancer care? We're going to talk about the neurobiology of your frontal lobe and why it's important to keep your frontal lobe online, because that's the best version of you. I'll define some mindfulness. We'll use it within the context of stress reduction, working with difficult thoughts. Where does meditation fit into this? And I just want to say, use what works for you, but I can really guarantee you that this is a key skill that you're going to want to figure out and practice and get better at if you want to be healthier and stronger in the long term. So I also just want to put this within the context. The bigger context is after lung cancer diagnosis, what do you want? Well, you want to maximize your longevity. You want to maximize your chance of cure potentially. So that's true. And the medical system is part of that. People want to feel better emotionally, right? All the unknowns and the fears and the stresses and the concerns of your loved ones, et cetera, around this. So how do you come back home to feeling more centered, more calm, more yourself, the best version of yourself emotionally? So there's a particular set of skills that goes around that. And then I recognize that in addition to those things, people actually want to be able to function better. They want to be able to think more clearly. And this is part of the set of skills. So even if you have some shortness of breath or have fatigue, you can improve your ability to think and work and connect with others. And ultimately, I think it's about a bigger purpose. So regardless where you are in your journey, can you connect more deeply? Can you live your life more meaningfully? Can you enjoy yourself more? Can you appreciate life more? So like these are things that you work towards. You take care of yourself through these physical, psychological information and skills so that you can have this capacity. And ultimately, I also think that people can grow psychologically and spiritually no matter where they are in their journey as well, right? So you can always get stronger psychologically. There's that kind of impermanent part of yourself that grows throughout your lifetime. So those can be some of your goals of what you want to do. And I'm touching on one kind of fine slice of the bigger picture, although it's all holographic, right? So you practice mindfulness, you come back home to the here and now, and allows you to tap into these other elements that are helpful to you. So, okay, so how do you do that? So how do you get complete lung cancer care? So it's the marriage of the medical system with what you could do to empower yourself, body, mind, and spirit. It's that the two together, and there is definitely an overlap. Starts out with understanding what's happening to you, what you can and can't do, what can influence within the medical system, outside of the medical system, right? So it's like getting that knowledge. And that's why Lung Cancer Canada and so many other organizations are very helpful to kind of put you in the empowerment from a seat from an information perspective. And then there's a whole level of getting the best care from the medical system, again, knowledge and skills. Where mindfulness comes into this is to recognize what's actually happening, to be able to see the truth, to be able to understand that your physician, your doctors are humans, they have personalities, to be able to see how they work best. And so you're trying to figure out through paying attention to what's happening to get the best care from the medical system. And then another obvious example is, sometimes the doctors use unnecessarily complicated words, kind of the baffle gab type of words. And to be able to recognize, I don't actually understand what my doc is saying right now. And then to be able to kind of step up and say, sorry, doc, can you just Can you repeat that again in simpler language? So again, it would take mindfulness to be able to watch yourself struggling in those moments, and then also the kind of advocacy to say, can you please help me? Can you please help me get better care in the circumstances? And so it's that attitude that you're the most important person in the room. So again, you're using the skill of mindfulness for a particular goal, particular outcome. And then there's the how do you empower your body? So you might be in the middle of treatment, you might have side effects from treatment. The cancer can be causing problems. How do you maximize your energy? How do you get as strong as possible? How to give yourself the best chance of getting through your treatments? Well, there's then the healthy lifestyle to recognize you have this human body, this mechanism, this vehicle, this kind of human vehicle. How do you feed and eat and exercise and relax? And how do you take care of this vehicle? How do you take care of the neurons between your ears that are firing like all the time? How do you make sure that you're giving yourself the best chance from that side? Right. So again, that's the knowledge piece. And I would say mindfulness is important in each of those aspects. So for instance, if you exercise too hard on one day, could be exhausted the next day. Right. And so you may want to learn from that and say, okay, I can only exercise to a certain amount before it really wears me out for the next day. And so then to recognize you can slowly maybe increase your activities over the weeks and months. And again, it takes all that feedback. When I exercise, how do I feel afterwards? How do I sleep that night? It's all this kind of feedback system that you rely on to make your decisions. You're kind of garnering personal wisdom through that. When you eat, what sorts of things do you eat in which circumstances, and how does that make you feel? How does it make you feel an hour after you eat, 2 hours after you eat? How does it make you sleep that night? Right. And so we have to really listen to our gut. I mean, that's a whole other very long talk about listening to your gut, being mindful of how your gut feels according to what you eat. And I mean, I could go into a longer talk about not ultra processed foods and eat food, not chemicals, mostly plants, not too much, right? Same idea. What are the tricks that you use during sleep? Same idea, trying to figure out how can I create the conditions so I'm more likely to get a better night's sleep? What works, what doesn't work? So, and nowadays we actually even have apps. A friend of mine who's on the Cancer Pet program, he recognized that he actually have to practice, or he had to practice a relaxation technique prior to going to bed. So for the 10 minutes just prior to going to bed, he'd practice that. And then his watch would give him an assessment of the quality of sleep. The nights that he practiced that meditation, that relaxation, he slept better. He felt better. So in some sense, his watch is taking over the place of mindfulness, of garnering that information. And then lastly, just the whole practicing a relaxation technique, settling down your stressometer. So we have a kind of natural amount of stress that we hold on to throughout the day. Why can't we, instead of kind of holding on to it up here, why can't we settle, be more at peace? Same external world is out there, same challenges, same decision making, but you're in a better space. You've lessened your stressometer through practicing a relaxation technique. And I think that's often the one that people forget about in terms of the physicality of their bodies. So we're going to get into a little bit around that. In fact, we'll do a little bit of meditation relaxation with you to kind of get you through this idea of how you use mindfulness and meditation to settle down your stress levels, to be able to tap into that more easily with time. Okay, so there's the level of the body, right? So body requires mindfulness. The level of the mind, right? What is it that causes you to feel sudden stress? It's just even the memory or the projection of having to go into the medical system, right? So it's like recognizing your own triggers. Well, that's my trigger. That's how, and this is my stress reaction. This is my stress signature. So again, paying attention to how you as a human being interact with the world is the necessary piece. And so that's like stress reduction and like lots of other things, working with difficult thoughts, practicing gratitude. There's lots of psychological ways, attitudinal ways that you can actually promote your own healing. Because if you're in that space, more clear thinking space, you remember what's most important to you, then that can percolate down into the physicality of your body, less stress, body's better able to heal, better immune function, better able to get through your treatments, et cetera, et cetera. So there's body, now mind. And lastly, nurturing a spiritual perspective. Again, it's very individual, but I'd say even for all of us, remember what's most important. Like how do we want to spend our energy? Do we want to spend our energy worrying, or do we want to put our energy into the things that bring us meaning and peace and connection? And then there's the connection piece, which is probably even bigger than a spiritual perspective. Okay, so the first thing I want you to understand is that we humans are wired to get better at whatever we practice. All right, so I'm putting down setting up the intention as the exercise here in the slide, but I want you to listen to me, like listen to the words right now. If you practice being stressed, flustered, upset, your brain and the neurocircuitry of your brain gets better and better and better at being in that state of mind. If you practice relaxation, being calm, at peace, clear thinking, there's a different part of your brain that gets stronger and stronger. And as this part gets stronger, the relaxation side of your brain gets stronger, the worry stress part of your brain lessens with time, right? And so for me, it's important to remember, I want to manifest on this side. I don't want the world to be blowing me this way and that, causing the kind of stress reaction all the time. So practicing relaxation in the midst of it is good, and remembering what's most important to you is good. So that's the kind of introduction to say you can practice this in the day-to-day, and you'll get better and better and better at that, and your brain will actually physically change. The wiring will actually physically change, and they prune down the pathways on the other side. So remember what's most important to you. So how do you want to be in the world? Like, what do you want to manifest? What's the best version of yourself? What do you hope of yourself? Right? Do you want to practice that? Be in that state more and more and more. It actually correlates with you being in your frontal lobe, and I'll talk about that one later. But the idea is to be conscious and deliberate, to say, this is what I want to do. This is how I want to be as a person. This is what's most important to me. Let me go there. Let me practice this. Let me be better at that. So you're setting your intention deliberately. And so then the second point there is that you can do that as a ritual. Like for instance, first thing in the morning, my wife and I, if she isn't off like running to work and publishing papers and all that stuff, my wife and I actually sit and do a meditation for about 10 minutes. And during that meditation, I use just a mindfulness technique, mindfulness of breathing. And I'll describe that later on, for about 10 minutes. And then at the end of that, I say a kind of maybe like a secular prayer saying, help me be a better version of myself. Help me be helpful. Help me be kind. Let me be clear thinking. Let me be, giving my patients good care. Like, I'm kind of saying this prayer, like, remember this, try to, manifest this within my life. And I'm thinking that there's actually a subconscious mechanism whereby I'm more likely to stay in that state of mind throughout the day if I practice, as I remember it as a routine. I mean, you could do that routine before you go to bed at night, maybe reflect back in terms of how the day went and say a prayer in some sense that way. So that's the kind of ritual. The second one is in preparation to going into a circumstance. Right. So maybe you're going into a medical visit, or maybe, you have to have a stressful conversation with a relative, or, have a big presentation at work, or like something that's stressful that's coming up. And then just before going into that circumstance, you kind of come back home again. You're letting go of the catastrophizing, nervous, anxious mind, and you remember, oh, my goal here is actually to love other people. That's what I want to do in this circumstance. I want to be in this space. Or you're going into a medical appointment, you're going, I want to get the best care from the medical system. I'm going to remain clear, calm. I'm going to advocate for myself. I'm going to remember what's most important here, which is my health in this circumstance. So you're like, focus there. You're having a presentation, the audience, you're more concerned about the audience's well-being than you are of your own nervousness. So again, going into a difficult situation, you're going like, this is how I want to be here. And lastly, and which is the hardest one, is in the midst of the chaos, right? So we're all going to get flustered, upset, scared, overwhelmed. It's like normal. This is going to happen to us kind of up and down throughout the day. But again, the mindfulness piece, I'm going to point you to where this is, can you recognize, oh, I've got myself really upset here and kind of unnecessarily. I'm flustered, I'm scared. Okay, so let's remember what's most important. I recognize that. I'm going to let go of that. I'm going to come back home to the better version of myself. And that's the hardest one to do, is kind of come back when you're already flustered, right? But this is a practice and it requires mindfulness each step of the way. Okay, so that's a big warm up to say, let's do that together. I'm going to take you through maybe about 2 minutes of like pure mindfulness by bringing your attention into the here and now. And then the second half is going to be around a visualization of opening your heart and like sharing that kind of compassion and well-being, good feelings for other people. And then you're going to remember what's most important to you. So I'm going to take you through that exercise as an example. So to start out with, if you're sitting and it makes sense for you, you can pull yourself off the back of the chair, but you don't have to. I just happen to like having a stronger posture. So the feet flat on the floor, the hands on the knees, and then you can even lean forward a little bit and then arch back just a little bit to kind of a strong and upright posture. And just the feeling that your heart is just being pulled up a little bit, top of the head drawn towards the sky. And so the first thing is what I call body up. You're taking your seat. You have that kind of noble, strong stance. Your body is telling your brain, I'm important. I want to heal. I want to get better. So you take that stance. You're telling yourself this is important now. And then the mindfulness piece comes in of bringing your attention into the physicality of your body. What does it feel like? Without kind of commentating, it's more like just experiencing what the bottoms of your feet feel like. So you're bringing your attention there. And when you bring your attention into your body, I believe that you're actually energizing your body as well. So bringing your attention into the sense of the feet connected with the floor, with the earth, the weight of the hands on the knees. And again, it's like curiosity. What does that feel like? What do my hands feel like right now? Maybe the sense of energy around your hands, you might notice that. And then the weight of the body in the chair. Again, bring your consciousness where your sits bones hit the chair. What does that feel like? And now bring your attention into your spine, middle of your spine, whatever is there. You don't have to change anything, but just give yourself a sense of being solid, strong-spined, grounded. Bring your attention now to the middle of your chest, or the front of your chest, in the heart center. Very curious, what does that feel like? You might feel like an openness or warmth, maybe a vulnerability, maybe a rawness. It's okay, whatever's there, it's your warm-hearted humanness. Very nice. Now bring your attention to your breath. Don't have to change your breathing in any way. Just be curious. What does that feel like? You might notice the abdomen rising and falling. You might notice the sensation of the air going through the mouth and the airways, nose area, in and out. Very nice. Just be curious, even with a sense of gratitude. Sense your body is being breathed. Okay, so I'm going to teach you the first relaxation tweak, and that is take a longer, slower, smoother out breath. So the out breath becomes very slow, smooth. And again, you can breathe at whatever rate is best for you. As long as you're trying to slow down the out breath, you can take a deeper in breath to compensate. And then slow, smooth out breath. And that sends a relaxation response to your brain. You might notice through your mindfulness that you're thinking about other things, and that's okay. You bring your attention back to my voice and the exercise. Long, slow, smooth out breath, maybe for a count of 6 on the way out, count of 3 on the way in, and again, whatever feels good for you. And at the same time, be curious. What does that feel like? Very nice. Okay, so that is a little variation on the breath. You can go back to breathing normally. And now we'll do the visualization. So imagine that you could warm up your heart center, the middle of your chest, with a feeling of caring or compassion. What does that feel like? Just allow yourself to warm. Bring to mind somebody that you love. Allow your heart to open. Send some loving energy. Maybe it's to your pet. Maybe it's to a person at a different time in your life. But just send them that loving energy. And allow your heart to warm. Now bring to mind somebody in your life that you know who's suffering. So it could be somebody close, somebody at a distance. But you can see them suffering and your heart opens again. You're warming up your heart and you're sending like a wish or an aspiration to them that they find healing in whatever way is best for them. So again, you're just allowing your heart to open, sending out that loving energy. Bring to mind now your loved ones and friends and cherished colleagues. As those images and names come up in mind, allow your heart to open again and wish each one in turn. May they find healing in whatever way is best for them. Let them know that you love them, care for them, you want them to be happy, at peace. Extend that again to everybody who's affected by a lung cancer diagnosis in Canada, for instance. So from that limitless space in the middle of your chest, just radiate outwards. Everybody who's on this call or watching the video afterwards, may they find peace. May they find healing, whatever way is best for them. So you're like a being of light. You're radiating elsewhere, everywhere. And to everybody in the world, anybody who's suffering anywhere, let them find peace. Let them find healing. It's like, be a radiant star, beautiful healing star. Now recognize that as you're doing that, you're also sending that same loving energy throughout your body. It's permeating through your heart, through your lungs, through all the tissues in every direction, sending that healing message into your psyche, into your emotions, into your relationships, into your spirit. Beautiful, radiating everywhere. You just happen to be the collateral of that loving energy you send to others, you're sending also to yourself. And from that space, decide in your own mind, how do I want to be in this world? What do I hope in myself? How do I want to manifest? You've been given this beautiful spot to shine your corner of the universe. Just allow that to shine in whatever way is best for you. Set that aspiration for yourself, the best version of yourself. And let it be so. Now relax any sense of visualization or trying to accomplish anything. Simply bring your mindfulness into the physicality of your body. So that kind of sense of being connected, feet flat on the floor, hands on the knees, weight of the body in the chair, your strong backbone. So you're solidly connected with pragmatic earth. And also allow your mind to expand. Ooh. There's a sense of possibility and transformation and peace and healing that's also available, and that your heart contains those two. You're connected with the physicality and the potentiality. And that has a really positive influence on your psychological and even your physical health. Nice. I'm just going to finish with the chimes now so you can begin to relax there. Break that energy. Very nice. In fact, why don't we just have a little stretch on the spot? Just stand up for a moment and just look up and away from the computer or the screen, stretching a little bit in whatever way feels good for you. Maybe hand on the heart, hand on the tummy, right? So you can bring the meditative state into the physicality of the body as well. And also, it's 5 minutes on the hour, meaning to stand up 5 minutes on the hour, not to sit for too long a period at a time. Okay, so you can see the first variation of this is mindfulness, mindfulness of the body, mindfulness of our physicality. It's called, the part of the brain that's this associated with is the insula, and the ability is called interoception, the capacity to be able to see what's happening within your body itself. And it is actually part of the higher part of your brain, right? So you can either be stressed and thinking out of the stress part of your brain, or you can be in your higher brain, your frontal lobe, including your interoception, right? And you kind of fluctuate back and forth throughout the day. But when you bring your mindfulness into your body, you let go of the catastrophizing mind. So it's important that we not get caught up in our thoughts so much that we become disconnected with the body. Even if your body is hurting in some way, it's okay to be conscious of what's happening there. All right, so that's kind of a first level of mindfulness. So what is mindfulness? Why is this so important? I mean, it's a skill. You practice the skill, you get better at the skill. And the way I think of it is how you garner information. So mindfulness is deliberately, meaning consciously, on purpose, paying attention to the here and now. The here and now is where the information is. Yes, you can draw on your thoughts and your reflections and your wisdom, and that will always be there. But what's actually happening in this moment is where your life is. This is where you learn. This is where you grow. This is where you love. And so if you're stuck in the past and all the regrets of the past or the worries of the future, you're missing out on the key piece of it, which is the here and now. And then lastly, so that's, here and now is where it's happening, I guess is the way to say it. And lastly, with a non-judgmental attitude. And I'm not saying just be positive and put on a happy mask on everything that's happening. It's more like just whatever is happening with this attitude, you're just kind of like taking it in. This is like information that I can use, that I can decide, how do I want to respond to the world? And sometimes I'm going to say, well, that's information that's not helpful. I'm just going to let it go. Sometimes that information is helpful. I'm going to be able to draw on it. But in some sense, I'm not kind of getting drawn into the, oh, this is really good. I want more of this. I need more of this. And oh, this is really bad. Oh, I don't want this to happen. It's like, oh, no, don't do that. Because in some sense, either one, whether you're trying to get something, I want more of that, or push something away, you're creating a kind of extra tension. It's like you're saying, this should not be this way, or I want more of this. It's like this kind of layering on of a judgment that puts the world or defines the world as good or bad. And instead, just to be with the world. And the baseline state is actually remarkably peaceful. The mindfulness state, if you take away the thinking state and you kind of get yourself back to yourself, which is you kind of your true self, it's actually very peaceful, very loving, a very positive state. So the non-judgmental attitude actually gets you back home to your default state, which is essentially like a loving state, I guess is the way to say that. So I'm not saying turn off your wisdom, turn off your judgment. Just recognize that that's information. So I don't have to judge the information of what's happening, and I can just kind of return to a kind of state that allows you to adapt and choose and be in that kind of more loving peace of mind and heartfulness. Mindfulness also means heartfulness. It's a state of mind more so than even a skill, for instance. Okay, so mindfulness. So we can get very abstract about it. I actually have my raisins close by. And in our courses, we do the mindful eating a raisin mindfully, or mindful raisin eating exercise. And I don't want to kind of wreck that for you, but we would look at the raisin, smell the raisin, feel the raisin, taste the raisin, eat it over about a minute and a half. And it all sounds a bit hokey, but it's a great analogy to say there is a lot happening within this moment right now that we can pay attention to. There's a whole depth and breadth of experience that we can miss out on if we're trapped thinking about what I should have done, regrets, jealousies, shame, guilt, whatever from the past, or this kind of over planning of the future. I'm not saying you shouldn't be planning. I'm just saying sometimes we get so caught up in trying to create plans B, C, and D that we miss out on connecting with our loved ones now, connecting with what's most important with us now. So again, mindfulness is bringing us back into the here and now. So that's why mindfulness is important. And now I'm going to take you through some practical ways that you use your mindfulness, decrease your stress levels to work with difficult thoughts, and then a little bit around kind of meditation, more of the kind of technique. Okay, so this curve is the stress response curve. You'll notice that on the x-axis here, if you're in like super peaceful state, it doesn't give you much motivation, and so you might not be able to do much. If you're like super chill all the time, nothing much gets done. And on the other end of the spectrum, if you're super stressed, overwhelmed, angry, upset, fearful, anxious, oftentimes we can't even think clearly. And so we also don't really function well in this world. And so the first step is to be able to recognize when you are overly stressed out, overly upset, how do you get yourself back up the curve here so you're actually functioning better? Now, first of all, to say is you're not going to get back to optimal. You're going to you always after improvement, not necessarily perfection, right? How can I think more clearly? And so you're kind of taking the stress off yourself. So that's the first level of stress teaching, recognizing when you're totally overwhelmed, bringing yourself back to thinking, functioning more clearly. The subsequent level of teaching is how do you get this curve at the bottom to turn into this curve up top? And that is a whole kind of your relationship then with stress and your relationship with how you see the world. And so if you can have this idea, well, this is stressful, something important's at stake, I can use this stress reaction to help me, then that kind of changes the philosophy and the perception, and even how your brain chemistry works. And that's a whole other talk in terms of the levels of stress here. But let's keep it simpler using mindfulness of super overwhelmed. How do I settle myself in that moment? Okay, so obviously mindfulness is the key to be able to recognize when this is happening, when you have the sudden anxieties and fears and stresses and angers and so on. So I want you to think about this very practically. Think about the last time when you're really stressed, really upset, really angry, really flustered, really overwhelmed, really scared, something that kind of it was a tough moment, and we all have tough moments. Like I'm I'm not trying to minimize that, difficult things don't happen. I'd say, how do we respond? How do we recognize? How do we function better? So you're imagining yourself in that stressful situation. The person is yelling at you, or you're in your doctor's office, or you're like something bad and difficult is happening. I shouldn't call it bad. It's difficult is happening. So imagine that in the midst of it, you could press a pause button on the video. So you're like replaying this video in your mind. When you're really kind of stressed, you're pressing the pause button, and you're going to do that same kind of scan of your body. And so how do you know you're stressed from the physical point of view? What are your symptoms? And so, lots of seminars later, people can feel their heart pounding. So the cholesterol, or so the adrenaline's pounding, their heart's going quite hard. The breathing can change. It's often hyperventilating. So you're breathing faster. Sometimes you're taking bigger breaths, and sometimes the breath can kind of get stuck. You kind of get this feeling of being stuck in your breathing, right? So that can be the cue. And I'm trying to prime you to understand your own stress reaction. The muscles contract. And so the muscles contracting around the head can give headache, neck pain. The muscles get achy or sore, jittery. Your intestinal system kind of shuts down. So acidity, stomach, bowel changes, sweaty palms, constricted throat. There's lots of different physical symptoms. You can say, oh, there it is. I am feeling stressed right now. Okay, so that's the first thing, to be able to recognize what are your physical cues. Mindfulness, paying attention in the here and now. Okay, so in that moment of great stress or fluster, how would you describe yourself emotionally? Right, so it can be anger, frustration, like seeing red, want to put your fist through the computer screen type thing. Can be the fear, anxiety, just feeling overwhelmed that way. Sometimes people feel like they're suddenly going to cry. The emotional system can kind of overloaded and cries. Sometimes it shuts off completely. So, so the emotions, or irritability, I guess, is the other one that I notice. I should put that on the list here. How does your thinking change? So when you're flustered, upset, overwhelmed, what happens to your mind in terms of the thoughts that are coming through, right? So for most people, there's this kind of fogginess. They can't think as clearly, or they become hyper-focused, fixated, or they get going just on the one topic. They're trying to figure out what to do, or there's loops, or there's lots of different ways the mind kind of gets constricted. I think constricted or limited would be the other way to kind of think of how the thinking changes. And then the other thing is the actual content of the thought. And the fingers can go in lots of different ways. It can be like, that guy's an idiot, that guy's a problem, or I'm such a loser, or life shouldn't be this way. There's like lots of kind of harsh judgments, like it's very 100% all or nothing thinking. If I'm swearing in my mind, that's a cue for me to say, oh, I've worked myself up on this one, haven't I? Or labeling, that guy's an idiot, I'm an idiot, that type of thing. So different ways. So you can think of it as if you had a magical computer program that could print out your thoughts 24/7 for a week, and then you go back and read that book or that transcript, how would you know from the language, the content of the language, that you were having a stress reaction at that point? And we do have a kind of lot of repetitive types of thoughts. So again, I'm also trying to normalize this for you, right? This is the normal things that we all do. We can, just forgive ourselves that we're human like the rest of us. Okay, so then if you can recognize, I'm stressed, I'm scared, how do you get yourself back? How do you get yourself thinking more clearly into your better part of your brain? So this is why we develop these skills, the skills of mindfulness, the skills of relaxation on the spot. Have a plan. When I stress, I now know I can do 3 slow out breaths. That actually really helps, right? So because I've been practicing that every morning, starts to generalize throughout the day. It's like, okay, I can settle. I've got some time. Let's settle this down. So then the other one is, I'm trying to point you towards this idea of interoception. It's like part of your brain that's going to be able to watch yourself. It's the observer consciousness, which is actually you. It's like you're observing the physicality, the emotions, the sensations, the thoughts. It's like you're that bigger observer consciousness. And as soon as you go there, you're also engaging that same part of your brain, which is the interoception. Watch, be curious. Oh, what can I learn here? If you can't talk yourself down, I'm going to take you through the technique. Then you can do what I call, well, the breathing technique is one of them. So if you can't just say, okay, relax, you can do this. You can actually then use the breathing technique, which I'm going to show you to kind of settle yourself down. You can, what I call body up again. In fact, you can slump right now if you want to. Slump down, even pretend you're chewing gum or something like that. It's hard for your brain to believe that you're stressed and flustered if your body's in a very relaxed position, right? So it's sending a message up. If you're giving a presentation, for instance, you can remember, okay, well, after the presentation, I'm going to have supper with my wife. I'll feel good then. That also helps kind of get you through it in the interim. And then sharing with a loved one who's willing to really just listen and not correct you or give you advice is also very helpful when you're in the midst of it. Sharing, putting some labels on it, gives us some distance from it. Okay, so this is the technique. First of all, you recognize, the sooner you recognize, oh, I wound myself up, the easier it is to kind of settle yourself down again. If you really get yourself wound up, it's harder to, because all the adrenaline's there. And it takes about 90 seconds for it to kind of flush through the system anyways. But you press the pause button because usually you don't have to do a quick response on the spot. You can actually settle yourself down before you're going to go there. Use your interoception, use your mindfulness, and do this right now with me. What does it feel like right now within your body? What does that feel like? Yes, very good. Physical sensations. And then there's the 4 slow breaths, as we did before. You can do them with me now if you want. Slow out breath. That's sending a signal up to your brain to say, I'm safe. I'm okay. Slow out breath. And you're using your mindfulness at the same time. Slow out breath. Be curious. Very nice. And again, slow out breath, right? And allow the body to relax as you're saying that. Nerve is going up top. Now you've got access to the higher part of your mind, your frontal lobe, that wise and kind part of it says, look, yes, this is stressful. I understand it's stressful. We can take this one step at a time. You've been through difficult situations before. You can make the best of this. You've got this covered one step at a time, right? So it's that kind of encouraging, loving, wise, like the wise grandmother, the very good coach type thing. So you're talking to yourself. So to go over the steps again, you recognize, oh, I've wound myself up. You let go of the catastrophizing thoughts by pressing the pause button, becoming very curious of the physicality of the body. 4 slow breaths. Nice. And then you talk to yourself. I can do this one step at a time. Kindness, wisdom in that moment. Okay, so that's a technique that allows you to interact better, make better decisions, feel better in the midst of a stress reaction. Okay, next I want to talk about difficult thoughts, because now the next step up, kind of the understanding, is that your thoughts, you can also watch your thoughts, right? So it's like the observer consciousness can watch your own self think. It's like metacognition around your thoughts. And this is, well, there's lots of kind of science around it, but this is the acceptance commitment training, which is called ACT, based on, well, I'm using Russ Harris's work, but there's, Stephen Hayes, there's a lot of science around this, that we accept that some things out of our control, but we commit to taking action to the things that we can as per our values. And it's training in the same way I'm talking to you about training of mindfulness, that you can improve these skills of staying more centered, more grounded, more peaceful in the midst of this external world, right? And the issue is that about 80% of our thoughts are, quotes, negative. It's often judging others and oftentimes judging ourselves is really where we get hung up with this. And I want you to give you an idea of the kind of the mindfulness piece, the difference between mindfulness and then being fused with our thoughts. So I want you to do this with me. Put your hands as if you're reading a book, but with the fingers, like the slight distances between the fingers. So there's a little bit of gaps between the fingers. So you're kind of holding on to a book. And imagine that your hands and the book or whatever represent the negative thoughts or these difficult thoughts or the thoughts that you're having. And I want you to slowly raise your hands up until your hands are just right in front of your face. So now you have your hands over your face. So I'd ask you, how does that feel? How does that feel to have your hands on your face? So you say maybe a little claustrophobic, a bit constricting, and can you see what's happening beyond your fingers? And you say, yeah, a little bit between the fingers, but I can't really see what's happening. Well, the hands represent our thoughts, and what's out beyond there in the world is the things that are important to us, our relationships, the things that we need to do, the information that we need to make good decisions, like allowing us to connect with others, to love, et cetera, et cetera. So we can either be fused to our thoughts and not be able to do that very well, or we can lower our hands. The thoughts are still there. So I'm not saying get rid of your thoughts, fight against your thoughts. You can kind of just like set them aside so that you can see what's actually happening, make good decisions, open your heart, connect with other people, live out your values in whatever way is best for you, right? So again, the idea though is that the thoughts are just thoughts and we can kind of set them aside. We don't have to pay attention to them. Sometimes they're helpful. Sometimes they guide us. A lot of times the negative thoughts are not allowing us to enjoy our lives as much. So then how do we do this? How do you kind of let go of your thinking? So you have to be able to see, first of all, mindfulness, that the thoughts are there, and then you're looking at your thoughts. It's like observer consciousness, watching myself think, rather than my thoughts are everything. Whatever I think is true 100% of the time, like that's the truth, as opposed to, okay, just be curious. So noticing rather than being caught up in them, letting the thoughts come and go. They're going to come in. You can't stop, and it's not a good idea to stop the negative thoughts from coming in, because then you just create a tension, right? And so as we do cognitive diffusion, we don't have to believe those negative thoughts so much. We don't have to be influenced by those negative thoughts so much. You're giving yourself the space through mindfulness to not have them influence you as much. Okay, so examples of limiting thoughts. So in our program, we encourage people to, for instance, exercise. So what could be some limiting thoughts to exercise, even if it's like a baby exercise? Well, you could be saying, well, I'm too lazy. I always give up. I'm not the type of person who exercises. Or strength training. I can never do that. It's too hard. And yet I can tell you through our program, we start out very, very simple, and people slowly can build themselves up no matter where they are on their journey. You might think of yourself in terms of diet, either you know you're eating something that's not healthy for you, or you're not tapping into the healthier diet, and you can see yourself making those kind of errors. And then you think to yourself, oh, I can't correct that. I don't have enough willpower. I'll never change, right? So those are just thoughts that in some sense are limiting. If you actually believe those thoughts, then you actually are going to have that self-fulfilling prophecy of like not being able to deliver. You could be diagnosed with a lung cancer. Now, this is an interesting one. So you could get a diagnosis of lung cancer and then have the thought, I'll never get better, or this disease is ruining my life, like it's really influencing my life. Those thoughts may be true to a certain degree, but although miracles always happen and there's always breakthroughs in medicine, et cetera, it doesn't matter if the thought is true or not. Is the thought actually helping you? Does this thought help me work towards what's most important for me? So, right. So being angry at something that happened 25 years ago, thinking of that person is no longer helping me, even if it's true what I think about that person or that situation. So we want to see, is the thought helping me or not? And let's just not go down that rabbit hole if it's not helpful. Exercise in diffusing thoughts then. So you start with your unhelpful thoughts. So you can have an unhelpful thought like, um, uh, my doctor's an idiot, or I'm such an idiot, for instance, right? And so then how you recognize that, your mindfulness recognizes, oh, I just had that thought. And then you add the line, I'm having the thought that, you put that onto the thought. So I'm having the thought that I'm such an idiot. So that's just adding a little bit more space. And then to the next letter, you add, I'm noticing, right? So then it goes, I'm noticing, right? Now you're into the observer consciousness. You're watching yourself thinking, okay, that thought's come out. Oh, that's a thought. I'm having the thought that I'm such an idiot, right? The result is it allows you to pause. The mindfulness allows you to create some distance. And then the decision is, what can I do with that? Is this working for me? Is it helping me? Maybe I can take this a different way. Maybe I can practice this little idea of being mindful for a moment, or practicing a few breaths before I take that next step. Other ways to diffuse. And it sounds a little bit silly, but you thank your mind. Oh, well, thank you, mind, for letting me know that I'm such an idiot, right? So you're kind of teasing a little bit silly. Oh, thank you, George. You call your mind. Thank you, George, for telling me that. Or you acknowledge it as a story. Oh, there's that story again, that I'm such an idiot, or I'm not good enough, or, okay, I see it. Yeah, there's that story again. It's a different version this time. So it's almost like, again, you're kind of gaining some distance around it. You sing the thought, I'm such an idiot, and that's okay. I'm such an idiot, and that's okay. And so it's like, again, or in different voice, yeah, I'm such an idiot, old boy. So it's like, you're kind of mocking it in some way or form, or repeating the thought like verbally many times. I'm such an idiot. 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 And so it's like turns in this kind of mumble jumble, and you recognize those are just sounds and those are just concepts. I don't actually have to believe the thought. So the different ways to give yourself distance, but it means that you have to recognize the thought first. Okay. Yeah. And then you do that one little thing. Well, the one little thing could be to take a few breaths so I can calm myself and be more at peace, right? You're giving yourself some option there. I think I'm going to stop there because I gave you the hand model of the brain already. So the mindfulness and meditation part is, in terms of the hand model of the brain, the wrist is the the lower wrist is the spinal cord. The base of the thumb is the reptilian brain, which is the back of your brain. The thumb itself is the limbic system, which is the emotional system. And then you have your fingers curling over top, which is the wise and compassionate part of your brain, your frontal lobe, right? And so we go all day long between being flustered and disengaged from our frontal lobes and coming back home again. And so if we can be mindful, using our mindfulness of what does that feel like, what's happening right now, we can decide consciously to re-engage and be the better version of ourselves. So that's mindfulness. I want to pitch to you the Cancer Patient Empowerment Program, or Cancer PEP, because we're going to teach you all the skills, many, many, many skills that I've been talking about. So 6 months, daily, science-based. It's all home-based. It's all easy to do. We send you an email, these little videos by myself and my wife, who's a psychology professor and scientist. Comprehensive, very, very comprehensive, with these little 3 to 5 minute videos as well. And so we recommend exercise that's fun and easy for you. Strength training and yoga that you follow by video. You do our videos with us. There's dietary advice every day through the emails and the videos. Talk about time restricted eatings. We teach you these relaxation techniques that are helpful. So I'm teaching those skills. Sleep science, there's a whole science around habit formation, stress reduction, relationship teachings, attitudinal healings, very, very comprehensive. And also we've proven that it actually improves quality of life. There's an opportunity for a buddy system whereby you would call two co-participants once per week, or another option is a monthly Zoom video conference with us, with other people in a similar circumstance. So that's what we're doing. Cancerpep.com. We're hoping to partner with the Lung Cancer Canada to offer this for free in some way or form, or some super reduced price. You can learn more at our website, cancerpep.com. There's my wife and I, our little daily videos. We offer weekly cooking videos. And I think that's it. So I just want to maybe stop the presentation there, stop the recording there, and then we can go on to the Q&A, or we can Q&A right now as well. One of the questions was, are there certain online meditations that you would recommend? Yeah, so there's lots of really good stuff on the web. So Calm is one of the apps that's very good. But I would go to YouTube. I would do a search around meditations, and you can listen to different people's voice and different techniques and get to choose the meditation that you really enjoy.